It is 12:03, Dr. Payne Show, 416-870-6400, star 640 on your cell phone. You can call through over the next hour. You got pains, problems, issues. Dr. Payne is here. 1-855-55-Dr. Lou, DRLOU. By the way, free consultations. Get it happening and get on the road to being, I won't say pain-free forever, but you'll feel much better. That's the whole point of the show.
Yeah, pain-free is sometimes tough to achieve, but definitely managing your pain. Now, doesn't mean you can't be pain-free, right? Some things do. You know, I know that sometimes I talk about, and it seems a little cynical that a lot of things are just a management issue, but some things do heal and never rear their head again. But, you know, when we give advice and I give you information, I'm giving it based on the most up-to-date evidence base. So I can't sit here and say, things disappear. The evidence would suggest that a lot of things are management based, but, you know, it's all individual, and some people do absolutely recover and never have that injury rear its head again. And I think that's great. And that's, you know, part of pain management is just that some things are going to heal the right way. It is what it is. So
what do you got going on, pal? Week that was. I had a case this week. This was interesting. Not the diagnosis wasn't overall complicated for me. What I thought was more interesting was the history of this. So this is an older female who's been this is her second episode of severe neck pain, what she termed to be severe, with shooting pain down her left arm. The first episode was in the spring of 2017. Okay. It kind of resolved on its own, and now this. But she does have a long history of just chronic low-level neck issue. The same stuff I think that we all probably encounter to some extent. So she's got this more recent exacerbation of her pain. She is, going somewhere to get it treated. And she comes to me and she starts telling me about everything. Already just from the visual appearance of her neck when I was looking at her, it looked pretty bulky, which is usually an indication that bones are changing, becoming bigger, arthritis is happening. And I asked her, I said, has anyone ever sent you for an x-ray of your neck? And they're like, no, they were thinking of maybe sending me in a little bit if things don't get better. And I said, I think we should send you for an x-ray of your neck now. Like, this just based on the history you're telling me, sure enough, and I'm not somebody that says that degenerative changes equal neck pain, right? And I've gone through this a lot where it depends. It's a 50-50 because we can take 100 people out in the public, x-ray their necks. 50% may have degeneration, but not the same 50% have pain. So it doesn't always correlate. However, in this lady, 100%, it absolutely correlated. Okay. There were severe degenerative changes throughout the spine, leading to stenosis in the peripheral on the IVFs on the left side specifically, which is where her pain is much more so. But I thought it was, we shouldn't be afraid as healthcare practitioners and professionals that if someone's complaining about this stuff, take an x-ray, take a picture of it. Sure, why not?
People will talk about, there's ionizing radiation. And yes, granted, if someone comes in and you always have to weigh the risks and the benefits of any type of procedure, even something as simple as x-rays. But when you consider that this is a middle-aged woman, even a little bit older, she was actually more than middle-aged, she was almost a senior. What's really a series of neck x-rays going to do to, it's minimal. And the benefit that you're going to get from getting that information and now knowing what's there and treating it the right way, it provides you so much relevant information. And I just think sometimes, when you're doing something and things aren't getting better, that's when you investigate further. And it was just that history that she had this. She's had it again, not really getting better. I kind of could tell by the just trophic changes in what I could see that, there's probably some arthritis going on and there's some degenerative disc disease. I just needed to assess how bad is this degenerative disc disease. And I can't do that with just a physical exam. I have to now take an x-ray and look at this. And sure enough, it was there. And so now, at least we can provide that to whoever her treating professionals are. That way they know if they're treating, what they're treating. Because a lot of times as a treating professional, you may think you're treating something like the muscle, not realizing, no, this is actually stenosis. And if you're doing the wrong things, this person's not getting better. And so this is pretty consistent. It happens more often than I'm happy to admit, unfortunately. But this is why I'm here to kind of give that second opinion to people. And that's a lot of what I do is people come in, they already have someone that they're seeing. They just need a second opinion because they want to make sure that they're on the right track, or could they be on the wrong track?
So it doesn't hurt. Give me a call, get my opinion, and from there, if I think it's worthwhile for me to assess the situation and give a much clearer picture, then that's what we're going to do. And and a lot of people are taking advantage of this, and the outcomes for these people are getting better and better because they now know what's wrong with them. They have a second opinion. And I'm not saying I'm perfect. I've recommended my patients to get second opinions from other people in my team as well, right? And sometimes it's not uncommon that if you come see me, that I'll bring in one of my colleagues.
Fresh eyes, right?
Yeah, just even right in that initial exam, I'll say, hang on a second, I'm going to bring in another doctor that I have here and whoever it may be, and kind of say, and I'll just give them a quick history. What do you think? And it's just good sometimes to have a second opinion. Totally. It's just the right way to do it.
Yeah. Tell me a little about the consultation, the free consultation before we break.
Yeah, very, very, very simple. Free consultation. Give me a call, 1-855-55-DRLOU, or send me an email at info@paincarecanada.com. Name, phone number, a brief history, right? What this is, neck pain, 3 months history, etc. And then I will call you back, or I'll email you back. We'll have a bit of a discussion so that I can find out a bit more. And from there, I can make some recommendations.
We'll take our first break, 416-870-6400, star 640 on sale. You want to call through, got open lines, you have pain, you have problems, bring them on. Dr. Lou is here to talk to you right till 1 o'clock this afternoon. It is the Dr. Payne Show right here on Global News Radio, 640 Toronto. 12 minutes after 12 on a glorious Saturday afternoon, 416-870-6400, star 640 on cell. Other than that, you want to contact Dr. Lou outside the show, info@paincarecanada.com and 1-855-55 Lou, DRLOU. As we mentioned, going into the first break, at that free consultation happening. And get it moving. So a lot of people out there, I know some that are naturopaths, and they're cool. They believe in what they believe, but a lot of people are just ardent against medicine.
Yeah,
they're not a fan.
So naturopaths is a type of healthcare professional, but I think you're referring to just people in general. Mm-hmm. And this is a real. It's kind of a soft spot for me. It gets me going a little bit because I'm very much of the opinion that we have a lot of things at our disposal. We have very natural approaches, and we have the more Western, newer approaches of medicine and surgery that we have. And I think the fact that we have all of those things is absolutely amazing. I think it's great that we have everything, and I think everything has its place. And I think that the people that will benefit the best from the healthcare systems that we have in place now are people who are not closed-minded to one or the other. And it's funny because you'll meet people who are all on the natural side and completely against medicine and surgeries. And then you also meet the people who are all medicine and surgeries and completely against the natural side. And it's like anything, in moderation, if you can find that happy medium in between the two, is probably where you're going to have the most benefit. And it frustrates me a lot. I see a lot of people who end up coming to see me, and one of my questions that I'll often ask when someone comes in is, have you been to see your family doctor about this, or any, like, whoever is your gatekeeper, who's the person that you would regularly see? And the answer is often, well, not often, I shouldn't say often, but again, more often than I would like to hear, is, oh, no, I don't believe in that. I don't want just the medicine, and all they do is push the pills. I want everybody to know that there are no doctors out there that are looking to sabotage people, right? That doesn't happen. Everybody that is a healthcare professional, well, I can't say everybody but I can tell you that anybody that, minus that 1% or that minuscule amount that may be doing it for the wrong reason, the vast majority of healthcare professionals just want to provide the best care for people, and they're doing it based on their perception of what healthcare is. And it's funny, I hear people who say, I went to my doctor and they told me that I have to take a blood pressure pill, and I don't want to do that. That's all they do. They tell me to take a cholesterol pill or a blood pressure pill. And then I'll say, well, have they ever told you to exercise? Yeah, but, I don't have time for that. Well, what did you want dude. It's not like they jump to it, right? It's not always the first answers. A lot of the times people are told, quit smoking, get more active, eat a healthy lifestyle. They're given these things in chunks throughout their life from their healthcare professionals. It's the people oftentimes that choose not to take that advice, and then they get to the point where they have some type of malady, as you would call it, John, and they have this malady and they need to treat it somehow. And so if they don't do the lifestyle things to change those potential diseases, then the only thing left for this healthcare professional, this doctor, is maybe to give them medicine. So whose fault is it really?
Right.
Is it the doctor who's told told you, and not even that the doctor has to tell you. We're in a much more educated society now. We all know that smoking is bad for you, drinking excessively is bad for you, not eating a healthy diet is bad for you, not exercising is bad for you. None of this stuff is rocket science. None of it is groundbreaking. Nobody's listening to me right now saying, oh my God, I did not know that. Everybody knows that. If you don't make those lifestyle changes, and you don't do those things, then what can you possibly think is going to happen down the line when you have an issue? I had a person once that came to see me, and her husband were both smokers, and they started asking me about air purification systems for their home. And I just kind of laughed, and they were like, well, why are you laughing? I'm like, I part of my history is I asked, do you smoke, do you drink? I said, you're worried about an air purification system in your home.
You got a pack of Belmont Miles in your pocket.
Yeah, you're each smoking a pack of cigarettes a day. You should purify your lungs first. Like, that's what I'm talking about. And these are the type of people that are looking for these really overly natural approaches, or, what light can I put in my home and what this or what that. It's easy to do the right things, but when you need medicines, when people get sick, there's people that get diagnosed with meningitis, or kids, God forbid, and it's like, well, no, we don't want them to take antibiotics. No, there is a place for everything. And I just think, as a society, we need to realize that we have all these things at our disposal, and I think that's absolutely amazing. Just use them at the right time and the right place. Use everything at the right time and the right place, and that's all I can really say about that.
416-870-6400, star 640 on cell. Jack, good afternoon. How are you, pal?
Well, how are you?
Good. What's going on with you?
Well, nothing with me, but my beautiful 70-year-old wife was involved in a rear-end collision 2 years ago. She's had neck pain in her left side and the top of her head. We don't smoke. We exercise our whole lives. We eat well. We have a wonderful life, except for this.
Right.
This is causing pain. My wife can't read. Like, she was a voracious reader. She can't read more than 10 minutes. She can't bend her head a certain way. She still attempts to go to exercise 3 times a week. Now, she started going to an acupuncturist about 5 months ago. It's doing something to her, making her feel better. She can bend her head a little bit. We were told we should go to a pain specialist, ones that inject, like Novocaine or whatever that to stop the pain. What do you think about that treatment?
Well, I think, again, the treatment every treatment has its place in the management of some type of pain. Can I tell you for sure that it's the best option for your wife? No, I can't say that because I haven't assessed your wife. But is that something that is often a good option for people suffering from a certain type of neck pain? Yes, absolutely. The one thing that I can also say is when it comes to car accidents, see, the thing that often happens with car accidents, and I'm not sure if this is your case, and maybe if it is, you'll just, either agree or disagree with me after I've said what I'm going to say. But what happens is that people get into these car accidents. They then go for some type of therapy. The problem is that therapy is often just passive in nature. So what I mean by that is that it's someone else doing something to the person. And very rarely is there a proper rehabilitation component implemented. Now, I know you said you guys exercise and your wife exercises. But see, the thing about rehabilitation is not a term to just mean go do whatever exercise you want to do. Rehabilitation has to be very, very specific and very, very graded, so that it's introduced in a manner, the same thing as a kid's not going to start running. They're going to crawl before they walk, before they run. And rehabilitation of neck pain after traumatic incidents, specifically something as high impact as a car accident, often requires very, very proper graded rehabilitation. And unfortunately, it's often negated in people's therapy. And so I'm not sure if that was the case with your wife, but in the absence of good rehabilitation, that's really the key. That's what ends up getting people better for long term. It doesn't necessarily mean that they never have pain again. It just means that they do get better. The thing about car accidents is that when you actually break it down and you think about what happens, we're human tissue. Mm-hmm. And then you have these machines that weigh thousands and thousands of pounds at high velocities, even if you're talking about something at like 50 kilometers an hour. It's still fast.
Hello?
Yeah.
The vehicle that hit my wife, who was stopped at a red light, was an 8,000-pound parts delivery van.
So exactly. Wow. So that's my point. When you just stop and think of the transfer of momentum and energy that happens from these big, massive vehicles at these massive speeds into the human body, unfortunately, the result is often that pain is going to be there for potentially ever. It's just a matter how can we do things to minimize that. And oftentimes, the best thing that we see in research is very, very good rehabilitation. Jack, we've got calls coming in. I want to try to get to everybody. Have your wife call me. Let's go through it specifically and see what she's done. And let's see if maybe nerve injections are a potential benefit to her. But I'll have to do that by actually assessing her.
Jack, 1-855-55 Dr. Lou, DRLOU is the number. Back to more of your phone calls, 416-870-6400 *640 on cell. We continue on this wonderful Saturday afternoon with the Dr. Payne Show right here, Global News Radio 640 Toronto. It is 1222, 416-870-6400 *640 on cell. Get that consultation happening. 1-855-55 Dr. Lou, DRLOU, or info@paincarecanada.com. Very simple. Brian, good afternoon. How are you?
Hi. Thanks for taking my call. I have a pain in my right elbow that showed up about maybe 3 weeks or so ago. I was leaning on a floor or something, and a sharp pain just came right from the point in the elbow, not the inside, but the outside. And it kind of reminded me, I finally put it together about a week ago. I at one point developed shin splints in my legs, and it's a similar pain to that, like really sharp,
okay,
but much more localized.
Right.
And it's right in the point of the elbow.
Okay. And have you had this looked at by anybody?
I haven't, because I don't like going to a doctor's office without being informed. You know, I kind of like to do a little bit of research before I actually talk to them.
Right. So, yeah, I mean, you could do a lot. There's a lot of different things that can cause pain in the elbow, right? So I'm not really sure. This is kind of what I was talking about. You shouldn't really be delaying these types of things because, you know, I agree with you that being informed is probably a good thing, but that doesn't mean that you should be delaying somebody looking at it and assessing it, because there could be many, many things that could be causing that. It could be something within the bone itself. It could be one of the soft tissue elements surrounding that elbow, like the ligaments or the muscles in that area. It can also be a referral pain from another area of the body. So there's so many things. So in order for you to fully educate yourself on what it could be, that's almost the equivalent of saying, well, you've got to go to med school or physiotherapy school or chiropractic, whatever, and really learn the extent of all the things that could happen in that elbow. I would say as a start, going somewhere to someone who is, some healthcare professionals are better at assessing musculoskeletal injuries than others. So, definitely if you want a better opinion, I would say someone like a chiropractor or a physiotherapist is going to probably be better than your average GP at doing these things. But that doesn't mean that all GPs are not good at these things. I know some that are very good at diagnosing musculoskeletal issues. And depending on what the signs and symptoms are, that'll tip someone off to, does this person need to be investigated further in terms of an x-ray or something like that? Or does this sound very, very mechanical and we can probably just start treatment and it should get better? And so those are kind of the options. But step one is always getting your issue assessed. I mean, I see you're in Mississauga. You can come see me. We can assess it. We can take a look at it and figure out exactly what it is, and then get you back on to a path of recovery from that issue. But it's very, very hard to say what it could be because it could be so many different things.
Yeah, I get that. You said you had an office in Mississauga. I wasn't aware of that.
Yeah, well, I've got providers all over the place, but I do my assessments out of Etobicoke, which is not very far from Mississauga. So, yeah.
It's pretty close, yeah.
Yeah. So just give us a call and we can book you in for an assessment.
Thank you, Brian. 1-855-55 Dr. Lou, DRLOU. Get to, hey, Jeff, how are you? Good afternoon.
Hi, Dr. Lou. How are you? Thanks for having me.
No problem.
So I'm actually a very active 50-year-old male, and I run about 30 kilometers a week, but I have massive hip pain, and when I'm sitting, I can't even get up after, I'm sitting, let's say, cross-legged at the table or whatever.
Right.
It's just so stiff and massive and painful, and it's radiating up on my lower spine, so I mean, obviously you can't diagnose this, but
no.
I'm just wondering what I'm going to yoga and everything else, but it's just like wrecking me, man.
Have you had any healthcare professionals take a look at it, or no?
Other than yoga, other than a physiotherapist, no, not really. Yeah.
So you said the pain was in your hips. You called it. Does that mean the pain is anteriorly, like in the groin, or are you feeling it in the back?
It's radiating up the lower spine, right?
Okay.
So, and this is, I can run like 8K or 5K, it's no problem, but then after, like, if I'm sitting playing with the kids or having dinner or whatever, it's just massive after. Like, I can't even move it.
Right. Well, definitely the best option is obviously, like I said to the last caller, see me for an assessment. We can definitely get to it. But just to kind of take what you're saying and give some more information. A lot of the times, one of the things that you said is that you're a very active 50-year-old. Now, as we age, the unfortunate reality is that degenerative changes do happen. What you're kind of describing to me could sound like maybe there's some arthritis going on actually in the hip joints. And it's very common that people that have osteoarthritis, once they get going in their activity, they end up being perfectly fine. I actually have a hip issue from when I was a kid, so I actually have pretty degenerative hips as well, and I've tried to do a lot of running as well. And so what can happen is once you're in with what you're doing, it's no problem. Like you said, you can do your 8 to 10 kilometers and it's fine. It's what happens after when things kind of calm down in the body and enzymes stop working as well, and the pain that happens there. And that can be characteristic of that kind of degenerative changing going on. So definitely, and the thing with hip issues is I'll be able to speak to you if you're in my office. This is how quick these things happen with the hips. I'll be able to speak to you for about 10 to 15 minutes, and then all I have to do is lay you down and move your hips around, and I will have a pretty good idea if you've got arthritis going on. And if I think you do, then we're going to send you for an x-ray, and that'll make it even more evident. And depending on what we see with the x-ray, either we may say, okay, there's nothing overly significant there, you're going to have to manage it with physical therapy and massage and stuff like that, or maybe there's something more significant and maybe you're a candidate for some type of surgical consult and more specialized imaging like MRIs to assess the cartilage damage potential and all those things. So yeah, I think come in, let's assess it, and that's step one.
Thanks, Dr. Lou.
No problem.
Just, on my way to work out a good life. Thanks very much.
Have fun.
Weekend.
Jeff, we appreciate your call. 1-855-55 Dr. Lou, DRLOU, to get a hold of Dr. Lou when the show is over. Anytime for that matter. info@paincarecanada.com. Joe, John, I see you guys standing by. We will get to you and your phone calls as well. 416-870-6400 star 640 on cell. More Dr. Payne Show coming right up. Global News Radio 640 Toronto. 12:31, Dr. Payne Show, right till 1 o'clock here on your Saturday. 416-870-6400 star 640 on cell. Good afternoon, Joe. How are you?
Good. I have more of a story and a question.
Sure.
I had 6 months of pain in my stomach, and then I went to the doctor, and they said it's acid reflux or indigestion. Then I was losing weight, and I did a CAT scan, didn't see anything. After a while, one day I had blood in my stool, and I went in and they did a colonoscopy, and I had stage 2 colon cancer. And my question is to the doctor, after I got diagnosed and I did my surgery, I do these blood tests to check tumor markers, which is a good blood test.
Right.
I'm wondering, why don't doctors do that when a person's healthy so you can get a baseline? And then if you have any kind of symptoms, they can kind of see, hey, there might be some tumors there that maybe a CAT scan can pick up.
Yeah.
Doctors say it's a false positive, too many false positives, or you got to pay $100 for this test. And most people don't know it, but they can get diagnosed a lot earlier if they have something instead of, finding out the hard way.
Right. Well, so a couple things there. Number one, it's not specific to every type
of cancer, and there are a lot of false negatives and false positives that could happen with those. It is a more expensive test, so it's not as simple as, a complete blood count, which is more standard, much more affordable. Once you have a public system paying for things, there has to be rules on when things are done. The best thing here is when you have what I call a doctor with good clinical acumen, that hears a person's signs and symptoms and assesses them, you can then send for much better tests that will diagnose things like in your case, it would have been the colonoscopy. That would be the best test that you could have had to diagnose your issue. So I think to an extent, you're right. There probably are better things out there that we can do for baseline testing. The reality about a public system, though, is that it is very, very costly to do those baseline things. And actually, when you look at somewhere like the United States, where people pay for their own healthcare, there's a lot of clinics that offer these types of services where it's like, hey, get baseline testing for your arteries so that if you're at risk for a stroke, and get this and get that. Mm-hmm. And people pay out of their pocket for those things. So I don't think you're wrong in what you're trying to suggest. I just think in the system that we have, it would be almost impossible, because we would essentially bankrupt everything, because then where do you start and stop? Why shouldn't then everybody have a baseline MRI of their whole body as well, right? So there's too many things that you would have to include as baseline. And again, those are not the gold standards for the diagnosis of everything. But it is very, very important. And it's often used with people who are diagnosed to see if the tumor is potentially coming back, because that this person had cancer. And so it minimizes the false positives.
I just because it's a blood test, it wouldn't be as expensive.
No, blood. Just because something is blood work, it depends on what the blood work is, because there needs to be specialized testing. They are much more expensive than your standard, complete blood count and something like an ESR or something like that. So yeah, there is a cost to these things.
All right, thank you.
No problem.
Appreciate that. Thank you, Joe. John, we'll get to you next. Good afternoon. Thanks for hanging in. How are you?
Good. How's everyone doing?
Good. What's up with you?
Yeah, so I'm assuming it's self-diagnosed, but tendinitis, and it's just in areas. I've been very physical in my life, and in many different places: my knees, my shoulders, some areas in my back, hip, and my hip flexor as well, and it's just nagging. So I might play soccer, I might go to the gym, and then they flare up. I have to ice it. I'm wondering if it's possible there's some underlying condition. When I go see my GP, it's always kind of like, weekend warrior type of thing. He says, you're being active and you're kind of inflaming those areas again. But just getting to the point where I just kind of want to be the way I was when I was in my 20s.
How old are you now?
I'm 30. I'm not even I just turned 30.
Yeah, unfortunately, I'm just over 32, and things do start to break down. I know what you're talking about. Come see me. We'll do a full physical exam and neurological exam to see, could it be something underlying, like very, very rarely just based on your age and kind of the way you're describing your symptoms. But it might be what I like to refer to as functional related. Maybe there's issues in your gait patterns, your posture patterns that would explain those types of things to us. And that's where I would be better than, most GPs, because, their job is there something here that is potentially very, very serious. They don't tend to really focus on a lot of functional issues. And it probably is something like that it's more functional related. And so, we can take a look at that and do a lot of functional testing to determine if there's something there and how we go about treating it. But yeah, the reality is that there's a difference between 20 and 30, and there's going to be a difference between 40 and 30, and so on and so forth.
Okay, great. Okay. Well, you got my number. I left it there, so I'm looking forward to hearing from you.
Sure.
Brilliant. Thank you, John. We'll get to one more here. We'll slide in Teresa before the break. Hey, Teresa, good afternoon.
Hi, good afternoon.
What's going on?
I'm calling regarding my son. He's been in and out of hospitals, doctors, MRIs, colonoscopy, and all the tests, but they're not able to diagnose what it is. He basically gets pain near his abdominal area, like severe pain that he feels he has to go to the washroom, to relieve his bladder, but it doesn't happen.
Okay.
So the pain is more when he's standing.
Yep.
He also gets like nerve twitching, going through his groin.
Has he seen a neurologist?
He has seen everybody.
Okay. And they've ruled out any potential neurological cause to that?
That's right, they have.
Is there a lot of stress going on with your son?
No, the stress is from the problem that he's going through.
Yeah, well then that's still stress. That can be a cycle effect. Yeah, I mean, when you say abdominal pain, obviously the number one thing to consider, is there anything in the abdomen? If they've done blood work and different types of colonoscopies and scans, they've likely ruled that out. Another thing that can cause those types of symptoms are neurodegenerative and autoimmune conditions, something like, how old is your son?
He's 33.
33, yeah. So, he's in the age group for something like, multiple sclerosis or something like that. But if he's seen a neurologist and you're saying they've ruled that out, then really the only thing that becomes left is the gut has a lot of what's called parasympathetic innervation and sympathetic innervation, which is our nervous system. And, people who are under a lot of stress, and the stress can be because they're worrying about what's wrong with them, can start to have more and more symptoms of that nature. Having said that, I mean, I can't say for sure. Again, if you like, you can have your son come book an assessment with me. We can run through some testing. He can bring all the relevant tests that he's already had and see if there's something more there. But, in the absence of all those things being ruled out, the good news is you want those things to be ruled out, but you also want to get to the bottom of it. But there might be things that he can do from a more natural perspective. That's where things like naturopathic medicine, once serious things are ruled out, can be very, very helpful. So get your son to come see me for an assessment.
1-855-55 Dr. Lou, DRLOU. Teresa is that number, info@paincarecanada.com to reach Luigi through email. And more of your phone calls coming up, 416-870-6400, star 640 on cell, right till 1 o'clock, the Dr. Payne Show. Global News Radio 640 Toronto. It is 1240. Open phone lines. Feel like give us a call, get some answers. 416-870-6400, star 640 on cell. Hey, Don, good afternoon.
Yeah, good afternoon, Dr. Lou.
Hi.
I have psoriatic arthritis.
Psoriatic, yep.
And, sorry. And I've had both knees replaced.
Right.
Over the past few years, the right one and then the left one. Now, I'm experiencing extreme pain on the inside of both knees, like right within inside the joint itself.
Okay.
And I was wondering how that could be possible since they've both been replaced.
Yeah, well, you can still get knee pain after your knees are replaced because there's other tissues that they can't replace, like the muscles in that area. So it could be a muscular type of pain. It could be a referred pain from somewhere else, right, where you're feeling the pain in the skin. It seems like you're feeling it in that area, but it may be coming from another joint in that area. So it is possible. How long ago did you have the knees done?
That would be about 6 years ago for the one and 8 years ago for the other one.
Yeah, so it's starting to get towards, the point where they... Not necessarily that they've worn out at this point, but all of these replacements of body parts only have a certain amount of time that they really work well for. And then, I've heard that on average, they'll say about 10 years. So you might be just getting close to the point where you may need something else. But the reality is that, again, it's great for the bone pain that you may be having if you have severely arthritic knees. But it doesn't change muscular pain, right? And the other issues and the referred pain, those are things. That's why even getting treatment after you're done your surgeries is pretty important.
Well,
it could also be... Go ahead.
Sorry. I did all of the exercises.
Yeah.
And then I also went to physio.
Good.
And this pain has been like almost right after I've had the knees replaced.
Okay. Yeah. So then that's a good indication that it might just be muscular. Now, the other thing that's an indication of is that if you've had that pain for, that means 6 to 8 years, you're dealing with a chronic case of pain. That's going to be very, very tough to treat. Now, your case is also complicated by the fact that you have psoriatic arthritis, which is an autoimmune disease, right? Which means that you do have a predisposition for your immune system to attack its own tissue. And so when that happens, it, again, may be attacking tissue elsewhere and causing a referred pain. So that's, that's a compounding effect with multiple things going on.
I have another appointment with the rheumatologist next week. And I've been looking at this particular injection that they have. I believe it's intramuscular, and it's called Concentrix.
Okay.
And apparently that works wonders, but it's very expensive. It's covered by OHIP, but you have to go through 3 or 4 other medications ahead of time before that don't work, because I've tried 2 of them so far, before you can get that.
Right.
So are you familiar with like Concentrix at all or no?
I've heard of it, but I'm not overly familiar. The one thing that I can tell you with all of these things where people think that there's a miracle at the end of the line, you also set yourself up for failure if you think the other ones aren't going to work. That's
no. I've already taken the other ones and they haven't worked.
Yeah, and so
I was just looking forward for some kind of relief, because I have a very low quality of life, and with the arthritis, my toes are all crossed over and everything else. So I'm having a heck of a time doing a lot of exercise by any means.
Yeah, I can't comment much more on that injection just because I don't know enough about it, and I don't want to comment on something that I'm not 100% certain about.
I enjoy your show very much.
Thank you.
I listen to this every week.
Thank you.
Thanks,
for listening.
Don. Appreciate that. Moving forward, 1-855-55 Dr. Lou, DRLOU. Something interesting you were talking about before the break, and that is with the stomach issues and intestinal issues. A lot of it is it's nervous system, and I know from experience having sometimes something starts out as a physical problem, and then even after the physical problem has gone away, now it's up in your noodle. Right.
Yeah.
And I've had to go through CBT where it basically came down to a point saying there's nothing wrong with you, stop, and that's what got rid of it.
Yeah. Stress is our gut is very, very much innervated by the nervous system, obviously, and depending on what our mental state is like and our stress levels and all those things, it can affect it. And a lot of people that have what they think might be potentially life-threatening things ends up just being, we often will term it something like an irritable bowel syndrome, which is just essentially saying that, you have a somatoform type of pain, which means pain and issues being created by hyperactivity of the mind. It's the same as fibromyalgia. It's also kind of that person that was talking about it, the muscle twitching, all those things. Even muscle twitching are often related to just simply stress. And a lot of people don't realize stress can cause, if you look at the list of things that stress can cause, it can almost cause everything. And so, definitely with gut issues, I'm not saying that if you feel a gut issue or some type of intestinal issue that you should just boil it down to stress. You want to do like what you've heard our callers say is that they've ruled out the more serious causes. But once those things are ruled out, well, then that's when you go down the line and you rule out the most serious, and then you settle for a diagnosis that's most benign only once you've ruled out the most serious. And so once you start ruling out all those things, it's like pain, right? A lot of people think they have pain and they think widespread pain. They think it might be cancer or something neurodegenerative. They get all those things ruled out, and then what are they left with? It's chronic pain. It's fibromyalgia. It's hyperactivity of the mind. Now, remember, this hyperactivity of the mind doesn't mean that the fibromyalgia, the pain in your body, or the gut issues are fake. Yep. It's as real as it is because stress can cause that. And so now the question becomes, well, then how do you treat it? Well, if the source of the problem is a psychosocial issue, you have to treat the psychosocial issue. You can't just treat the physical body. And this is where, a lot of like more Eastern types of approaches like acupuncture, why there's a good effect with them is because they also do work on the mind at the same time. Just the way the practitioner may very well talk with you. It's so important even how doctors and healthcare professionals talk to their patients because it sets them up for failure or for success.
Sometimes a chat will work,
Just by the very nature of the things that you say to somebody, right? If you start saying, well, I'm going to put you on this, but it doesn't really work well, you're just decreasing the likelihood that it will work well. But the reality is we have to give the honest truth, the evidence-based truth. So sometimes if things don't work well, we unfortunately have to say that. But and that's kind of where you swim a fine line between being politically correct in healthcare and then also trying to do the best thing for your patient, because none of us can discount the placebo effect, and what we believe can happen can turn out happening, whether that's positive or negative. That if you believe something is going to help you, it might help you, and if you believe something's not going to help you, it might not help you. And just that belief that you thought that can contribute to the outcome itself.
Well, I mean, if you got sharp stomach pains and you realize you got to make a speech at a wedding that night, it might be correlated.
Yeah,
exactly.
Exactly. Yeah, if you got 100%. And so the mind plays a very, very. It's our computer. It's our processing system. Everything that we have in our body is real because of our mind. So that's what I mean. I often try to explain to people, if I cut, your spinal cord, you'd have no communication going to your body anymore. You'd feel nothing. So why is it so hard to believe that if you're stressed and you got things going on that it can create issues?
Right.
It's really not that hard when you break it down that way. And so, managing stress is a big thing, and stress plays a very, very big role in our health and the things that we feel. And it's not easy either. Me just talking about this,
Sure.
I'm not trying to downplay it. It's not easy to treat. It's actually almost harder to treat the stress side of things than it is the physical problems. But that doesn't mean it's impossible.
You bet. 1-855-55 Dr. Lou DRLOU. You want to book that free consultation? info@paincarecanada.com. And you still got time to call in to the show here this afternoon till 1 o'clock. 416-870-6400 star 640 on cell. Dr. Payne Show, Global News Radio, 640 Toronto. It is 12:51. You got some time to squeeze in a call. 416-870-6400 star 640 on cell. info@paincarecanada.com to email Dr. Lou. And call for that consultation, 1-855-55 Dr. Lou. You got a network all over the place. It can find you somewhere to go, if not the main hub in Etobicoke.
That is right.
Personally,
Yep.
right? Locked up knees. Jody, our producer, was just talking about knees locking up. I go, you're getting old, son. That's all it is. It's age, buddy.
Yeah, that can happen. Knee issues obviously become more and more prevalent as we age because they just wear down. Now, the other thing about the knee is it's a hinge joint, so it only moves two ways in between two mobile joints, which is the ankle and the hip.
It's interesting.
And so that puts a lot more strain on that hinge joint. So, you can start getting, when I hear a patient that says, hey, my knees are locking up, you want to make sure at that point that, the most serious thing that would cause that is something like a meniscus issue. So you want to make sure that there's no meniscus issue, and really some physical testing can point you in the right direction, and then likely having an MRI to confirm, if you do suspect there is a meniscal issue, that could be an indication. Then there's other things. It could just be functional. A lot of problems end up just being functional because of, the angle of the pelvis relative to the hip and the way that tracks the patella up and down. And so a lot of those things, knee issues, in my experience, there tends to be, I don't know if I can give you a percentage, but a lot of them are just functional issues where people, because they're doing different things or they have a problem. A lot of times the other thing with knee issues is it's actually just feeling pain because there's actually a problem at the ankle or the hip. And again, because it's a hinge joint, that area is breaking down more. So a lot of times that's where it's really important to get these things assessed early, because once the breakdown becomes significant enough, it can lead to a meniscus issue or an ACL issue, and that becomes more serious and is going to take a different type of intervention to potentially treat that.
It's amazing because people all different heights. They have different walking. Some people toes in, some people toes out. Their gait is totally different, right?
Some people have good mobile hips. Some people have very poor mobility in their hips. There's so many things that can affect the knees, and that's where having someone who knows what they're doing and knows how to assess it properly is most important.
Hey, Jill. Good afternoon.
Hi, how are you today?
Good. What's going on with you?
Just a couple of questions I'm curious about. The first one is I was diagnosed with lymphoma, which I know is the most popular cancer, and I have it in the groin, both legs. And they did some radiation several months ago, and gosh, I had no idea of the fallout of that. I felt like I was beaten with a bat in my buttocks and all the bones and muscles in my buttocks and hips. Anyway, I've recovered from all of that. And I'm coming towards a follow-up appointment in December very soon with my oncologist. And above that site, I've had to touch. It's got a painful area. And I'm just wondering if he says, well, look, they don't typically like to, from what I understand, do anything about it until it's causing you some discomfort. And I'm wondering if they respond with that, should I insist that we do some radiation rather than wait for it to grow and start to press on things?
That's a tough one for me to give you a proper answer. I really think that is something you need to know your full case. And I think, again, and I'm not an oncologist, so I don't deal with cancers. Okay. So I do definitely think that you should be having that conversation with the oncologist. And again, the important thing is if you have questions or concerns, just have that conversation with them. So just clarify for me, you said the lymphoma was in the lymph nodes in the groin area?
Yeah, both sides.
On both sides, okay. And what were your first symptoms? I guess bulging of the lymph nodes is usually what people...
Well, oddly enough, it was really... I had always felt for about 12 years or something, just like a minor kind of almost like a metal pain if I was even just walking my dog. And years ago, I thought, what the heck?
Mm-hmm.
Like, I'm in really good physical condition, and I played a lot of baseball and sports.
Right.
And when I went to New York, it was in December or so with my boyfriend. We walked a lot, which was fine. But then the last 5 or 6 New York blocks, which are huge, I literally was dragging my leg and could hardly, he was going to carry me almost.
Right.
So I had 9 large lymph nodes that were all swelled in there, and there's no room for them. So
right. And so
that was my first indication.
Okay.
I do have another question,
Sure.
if I may, sir, and I don't know if it's related. I don't think it's related.
Yeah, go for it.
I never get headaches. Ever.
Right.
And it was unbelievable. I was dizzy actually for a couple of months. Now, I told my doctor I was dizzy for a couple of months, just my general, practitioner.
Mm-hmm.
And he said, well, you know what, see how you're doing in another couple of weeks, and then we'll start to look into it. Well, damn, if I don't even know if it was, maybe about 7 weeks in, and I don't know if these are related. I just can't help but think they may be.
Mm-hmm.
I developed the worst headache, 22 days long, and I'm talking.
Oh my gosh.
9-alarm fire. I was on liquid ibuprofen. My boyfriend was, helping me with it, and I know he kept saying, "Go and get it checked." And I'm just one of those stubborn people that don't go.
Mm-hmm.
And it was so bad that there was a period of time that I could not even touch the left base of my skull. I couldn't even touch it. It was like I'd been hit there with a bat. And it was 22 days long.
Right.
And on the 23rd day, I woke up and I thought, it's there, but it's sort of sitting at the doorstep. And do you know that from that point forward, it was gone. And my neck was affected. I do a lot of laptop work. And I thought maybe I'm sitting wrong. It's the posture thing. What the heck's going on?
Mm-hmm.
And then over 2 or 3 days, it was gone completely. Is it possible it was meningitis? And if so, how did it repair itself? Like, what was that?
I don't know that it would have been meningitis. You would be meningitis is often related to bacterial or viral infection. So you would probably be very, very sick as well. Fever, all the classic flu-like type of symptoms, an extremely stiff neck. And usually it doesn't get well on its own. In fact, if you just leave it, it can lead to some very bad things. So it doesn't sound like it was that. Again, and I'm not 100% sure, but it could have been a million different things. It could be related to everything else going on. I think the good thing is that it's gone, and that's maybe where the focus should be. But give me a call if you're interested in just discussing your case a little further.
Hey, Dave, you got about a minute for you. What's up?
Hey, I was curious if the doctor would be able to comment on using ozone to treat osteonecrosis of the jawbone. I had what's called a cavitat scan from my dentist, and they said that there's possible underlying issues in the sockets where my wisdom teeth used to be.
Right.
And so the dentist suggested treating it with ozone, and I've heard a lot about ozone, but I wasn't sure if it would be successful in treating a jawbone infection. So I was wondering if you'd be able to help me out with that and comment on it.
Yeah, I don't know enough about ozone therapy. I mean, the premise is that you use oxygen to treat, excessive oxygen to treat things, since oxygen is what we need. I'm not sure if it's the best procedure for that. That's, again, where, maybe continue to have a conversation with whoever that specialist was. And, if they're recommending something, I would assume they're recommending it because it's the best option. But I'm not 100% sure about that.
That'll do it for another week, my friend. Appreciate all the phone calls moving forward. Want to get a hold of Dr. Payne? No problem. 1-855-55-Dr. Lou, DRLOU, or info@PayneCareCanada.com. Till next time, next weekend, right here, Dr. Payne Show, Global News Radio, 640 Toronto.